Well, hello, everybody. Initially, I wasn't going to do this on social media, but I decided in the end to make an announcement. Back in August, I was diagnosed with mantle cell lymphoma. It is a non Hodgkin's lymphoma cancer. It is a cancer of the blood that mainly shows in the lymph system. Um, I was diagnosed at stage 4, and I have an aggressive version of this cancer. Um, Same day that I was diagnosed with the cancer, they actually found this out through a PET scan and other tests. I was also diagnosed with pneumonia. So I was immediately told to go to the hospital to deal with the pneumonia. Initially, I thought maybe I would spend a night at the hospital, and it ended up being 4 days at the hospital. Um, I was very weak. I thought I had possibly the flu, and I thought after I had gone to urgent care, they told me to just drink plenty of fluids and get rest. They never tested me for pneumonia, but I thought I was going to be able to make it on my own, and in the end, I was coughing so much. I was coughing up blood. I got very weak. For me to sit up or walk or even eat was really difficult. In the process, I actually lost 15 pounds, of which in the last few weeks I still have not gained back that weight. So I was released from the hospital and spent a week trying to just recover my lungs. This is a few weeks out now. I have not regained full strength, nor has my energy level or muscle mass or anything fully regained, which is really difficult when you have a 4 and 6 year old who want to play all the time and want daddy's attention. So slowly dealing with that, being out of breath and being weak, and I'm trying to regain my appetite, trying to maintain my weight and hopefully increase. So I wanted to give a brief overview of what happened. So this whole journey started for me back in 2022. With the help of my chart app on my phone, I was actually able to see the trends of my blood work with my doctor on a regular checkup. And at that time, I noticed that my platelet count was going down below the normal level. And I mentioned it to my doctor as well as other ailments. I was complaining for years of having digestive issues, where my whole body felt very warm, like I was under a heat lamp. Nobody could understand it or explain it. My doctor sent me to a gastroenterologist. I did a colonoscopy. I did an endoscopy. I went to an allergist. I took all this allergy. My wife thought I had IBS or autoimmune disease, something along those lines. Nobody could figure it out. So kept having more blood work as time went on. And my doctor said if I have 3 or 4 times in a row of my platelets going down, they would send me to a hematologist. So, 6 months goes by, I do another test, it goes down. Another 6 months goes by, do another test, and it's going down below the normal range. So they sent me to a hematologist. The hematologist wanted to discover why my platelet count was so low. They had me do a scan, and they found out that my spleen was enlarged and my platelets were getting caught in my spleen. And so they originally diagnosed me with non-alcoholic fatty liver. They thought somehow the liver and the spleen working together was enlarged, and it was kind of like a watch and wait thing. And then more time goes by. It's fall of 2024, and my son started playing soccer, And his new coach, I recognized, and ended up being my hematologist. And I said to him, I'm like, hey, you're my doctor. I'm your patient. And so in the end, he and I, his name is Ian, he and I became friends, and I helped coach the soccer team with him. And so him and I started to form a little bit of a bond. And he started to remember me and was like, when's the next time you're coming in? And so the next time I was coming in was December 2024. I did blood work, and this time I used a different lab, which was Quest Diagnostics, than I used in the past, which was Penn Medicine. And I had, some abnormal results, but I wasn't really sure what it was. So I go in to see the doctor and the nurse practitioner, and I could tell just the way that the nurse practitioner was acting like something was a little odd or off. So she started asking me questions. Was I having night sweats and all this other stuff? And I was like, I kind of was, but I wasn't sure if it was what it was from. So when she left the room, I started Googling the one result that she talked about, which was it's called absolute pro lymphocytes. So I started Googling, like, what is this? So by the time the doctor came back in, I kind of had an understanding that it could be related to some sort of cancer. And they basically asked me, do you have COVID? Did you have RSVP? It was basically, they told me absolute pro lymphocytes was a component in the white blood cells, and it was an indication that my body was fighting something. It didn't necessarily mean I had cancer, but it was an indication my body was fighting, and this was an elevated number. So they asked me to wait a few weeks, get healthy, and retake the tests in early January 2025. So that holiday, I remember I talked to my family, and I was like, I mentioned to them, I'm like, God, maybe I might have cancer. I was like, I'm not sure. So January comes, I take the tests, and the test results started to trickle in from the app before I actually have my appointment. And I'm looking at the numbers. When I do it at Penn Labs, I don't see the absolute pro lymphocytes. It's like not a test that they test for. So I'm looking at the results and I'm thinking, okay, I don't know, maybe I don't have anything. So he calls me, and the doctor, he calls me and was like, okay, so far your results are looking pretty good. And then the next day he called me back, like more results came in. And then he's like, okay, I have to tell you, you have what's called MGUS. And I can't remember, monoclonal globopathy of unknown significance. It basically told me that I had cancer cells in me, and they had not yet turned to cancer. And he's like, it's only a 3 to 5% chance of it ever turning to cancer. It's more of like a watch and wait thing. And why don't we wait 6 months and we'll test you again? So 6 months comes by. I think I was supposed to do in June, but we were on vacation, so they moved my appointment to July. So it was like July 9th or so. I do the blood work. And again, I get the results before the appointment, and I'm looking at all this stuff, and I'm like, holy crap. I'm like, I'm off the charts on a bunch of these tests. And so instead of Googling things, I went to ChatGTP, and I put in all the information in ChatGTP, and all of a sudden I'm seeing like lymphoma, I'm seeing multiple myeloma, CLL, MCL. I'm seeing all these things related to some of the test results. And I'm like, holy crap, like I might actually have cancer. And so my mind at that time was racing. I was looking up a lot of videos on YouTube. I was talking to my wife, going crazy. My wife is like, remain calm, let the doctors do this, stop looking up stuff. There's a lot of different components. So a few days later, I go into the doctor's office. with my wife. She comes, and Ian, who's my doctor, says to me, well, we don't know yet. We want to do a couple more tests. You have some indications that this may be progressing, but we don't know if it's still in this stage or it might be in another stage or what. So he said at that time that he was looking at possibly multiple myeloma. And when he said that, I actually was like, oh boy, like multiple myeloma is not a good one. So he had me do more specific blood work. He asked me to get a bone marrow biopsy, and then he asked me to get a PET scan, and then he was going to have me do a urine test. So I do the blood work, and the blood work had to be done at Quest Diagnostics, and that takes a little bit longer to come in. And again, the results come in, and I could see them off the chart on that. And based on those results on ChatGTP, I did look it up, and it said potentially CLL or MCL, which is mantle cell lymphoma. So I stopped looking at the blood results because I was driving myself crazy. And then I did the bone marrow biopsy, which, if you don't know, they drill into your hip bone. It's supposed to be like one of the most painful procedures, but luckily they gave me twilight sleep or whatnot, so I didn't really feel it. And then those results came in, but it just said scan came in, so I didn't really know. So then I was waiting for my results to come in, and that week we just celebrated my mom's 80th birthday party. And that week I wasn't feeling well. And my parents, who were 80 and 81, were over, and I'm like, do you guys have like, are your muscles aching? Do you feel sore? Are you weak? Because I'm like, I feel like I'm 90 years old. And they're like, no, we don't have those issues. And I'm like, something's not right. I have low energy. I don't feel well. So I thought maybe I was sick. And so I first spent a few days trying to, sleep it off, lay in bed the whole day, called out sick. And like I said earlier, I ended up going to urgent care. Urgent care was like, it's past the first 48 hours. And then during that week, I got the PET scan, and on the Wednesday, and I go into the PET scan not feeling well. And for the PET scan, they inject you with nuclear radioactive material that they keep in a tungsten box. And then they do the scan, and I thought I wasn't feeling well because I had nuclear radioactive material inside me. And that night I had a fever. I was trying to stay away from my wife and kids because I was radioactive. And so again, I was lying in bed. I think I was 102, 103 fever. I know I was coughing like nonstop. I actually had a bag. I was spitting up phlegm constantly. My phlegm was brown, not like yellow or green, but it was brown, which I later found out was an indication there was blood in it. So I was constantly coughing. And then the next day, Ian sent me a text saying, your scan results come in, and can I talk to you about it? And initially, I kind of blew him off because I was like not feeling well. I didn't want to find out that I had cancer when I wasn't feeling well. And then he's like, your scan results show that you have pneumonia. And so he's like, can I come over? So he lives in the neighborhood. He comes over with the stethoscope. He checks me out, and my lungs are in really bad shape. I could hardly do anything. And he's like, you need to go to the hospital. So that's what I did. I went to the hospital, eventually got released. He told me at that point I had mantle cell lymphoma, but we initially didn't talk about it. So eventually he did do rounds at the hospital and showed me my scan. So I do have lymph nodes in my neck, my clavicle, my abdomen, and my lower abdomen, at least that I know of. And I saw the scan. The one in my neck here is glowing the brightest and it's most active. And I'm actually going to have a biopsy surgery procedure tomorrow to remove that, and they're gonna look at it under a microscope. And then the biggest one is like supposedly like the size of a fist, and that's next to my liver. And my spleen from last year to this year has also doubled in size. So I can actually feel my spleen right here. So with my spleen being enlarged, you throw in the lymph nodes, the space for my stomach has shrunk, and therefore my appetite has been greatly affected. This cancer specifically likes to go after the spleen and the GI tract. So my GI tract has been all messed up, which explains my digestive issues, which affects my sleep. It also affects the absorption of nutrients, which also throws off my numbers. So it explained a lot to me, my issues with digestion and sleep. So when I got the diagnosis, I had a feeling all along. And then you throw in the blood, the cancer being in the blood, it makes sense because that maybe explains the hot body feeling that I was having. So the plan right now is for me. I met with he recommended a specialist in Philadelphia. I met with her. Her name is Dr. Emily Tomasulo, and she's a mantle cell lymphoma specialist. She has a lot of recommendations from patients. She has patients from 18 to like 80. And this cancer, by the way, is normally for people who are like 70-year-old men. But here I am, 51, and I have it, and they don't know where it comes from. They say maybe exposure to chemicals, but like I have no idea what chemicals am I exposed to. So Dr. Tomasulo was telling me that they wanted to do another biopsy and get the results from my bone marrow biopsy to determine my treatment. They were recommending to do immunotherapy instead of chemotherapy. They've had, based on the studies, the immunotherapy was showing equal, if not better, results to chemotherapy, especially for younger people such as myself. So I was all about it. So she's going to be looking after all my test results, and then I'm going to get treatments locally with Ian 5 minutes down the road, which is great. So the way immunotherapy works is because there is no cure, the immunotherapy is going to come in through a needle. I'm going to have these weekly infusions where it's going to be several hours where it comes in. And the whole idea is to boost my immune system to attack the mantle cells and then use that to fight the cancer. So that's kind of the plan. It's called rituximab that I'm going to be on. Once the infusions are over, I'm going to be on these other oral pills, and I'm going to take those indefinitely until they no longer work. At some point, I'll have regular blood work and scans to see if I get into remission. So that's the overall plan. For me mentally, it's been a roller coaster. I'm not gonna lie. When I look at my kids 4 and 6, it's very difficult. With the recommendation of a friend, I ended up having a discussion with my kids about the cancer, of which my son Aiden understood it because he knows somebody with breast cancer. But my 4-year-old, she didn't understand it at all. She just kind of wanted to play doctor. So at least I feel like I can talk about it in front of him. For my family, everybody's been great and supportive. A lot of my friends, I just want to say thank you for reaching out. A lot of you have sent messages and gifts and made meals, and it's been amazing. The love and support from all of you is like unbelievable. I really feel loved, and I appreciate that. I'm going to try to, mentally stay strong and positive on this. I have a lot of people praying and rooting for me. And I know that staying positive is key. One of my other plans is to try to avoid like sugary drinks. I'm trying to eat smaller meals. I don't know if it's the cancer or just getting over the pneumonia, but haven't gained the weight back. And I've been drinking a lot of protein drinks, which I have right here. I've been throwing up a lot just because whatever reason I can't digest it. I think it's the limited stomach space. Um, like I mentioned before, like I have my ups and downs. On Friday, I noticed with my weight loss that my arms are thinner, my face is thinner, and I noticed my muscles, like my muscles looked like they were disappearing. And it really got me upset because I was like, why are my muscles disappearing? I'm like, what the hell is going on? I'm like, I don't want my muscles to disappear. So that really got me upset. And I think I'm in a better spot about it now, but like, I just want to do the treatment. My treatment starts on September 12th. So I just kind of want to fast forward to September 12th. Um, I joined some Facebook groups for support, and I'm gonna meet another couple who lives here in Langhorne. Another guy who's probably a few months ahead of me into treatment. Um, I know the treatment I'm gonna do is September 12th. They're gonna watch me. I know that there's potential. Uh, I've heard rashes or chills or back spasms, or I've heard your neck can tighten up. So I don't really know what to expect. Others talked about having fatigue. Some people have told me I'm going to feel better and that side effects are not going to bother you. So I have no idea what to expect. At this point, knowing I haven't started treatment, I feel like it's just growing and growing in me. And with the aggressive version, like just bring on the treatment. So, so anyway, I did decided to do this announcement because I can't call everybody. I would love to and talk to everybody and go into more detail. Um, I do get little tidbits of news. I did hear one positive thing on last Thursday, which was there's this marker called TP53. I was negative for that. And because of that, that means I should be okay with the treatment. If had I been positive, I would have been resistant to a lot of the treatment in my life. Expectancy would have gone down a lot more. Um, so I'm trying to stay positive. I get the treatment, and hopefully I will, be in remission. Hopefully I will be able to hang out and go back to doing normal things. I can't wait to be back into that. I don't like this, like not feeling normal and not being able to do things, especially with my kids or around the house. It's just hard because like it's not my personality to just kind of sit down and let other people do a lot of things. So thank you all for your love and support. I really appreciate everybody reaching out. To those of you who are listening to this, I think I'm going to do another video after the first treatment, and I'll let you know how that's going, and then maybe I'll do a few more after that. So look for those videos, and in the meantime, thank you for all your prayers and gifts and meals and love and support. I really appreciate it. Thank you so much. Love you. Bye.